Hi everyone. Today I want to talk to you a little bit about back pain, mostly the kind of back pain that we have that comes from soft tissue restrictions, whether that's from a muscle strain, you've lifted something that's caused you a little bit of strain or tension, or something that's just seemingly come on over time. You're not sure why or what's going on, but you feel a tightness maybe on one side of your body more than the other. A lot of times that restriction, or you're feeling that tension through your back, a lot of times that can actually be coming from your hips, can be coming from other areas of your body. So what I would like to show you today is how to release the front of your hips, that hip flexor region of your body. And it's not specifically just the muscles, because we need to look at all of the tissue surrounding it, the tendons, the ligaments, and most importantly, the fascia, as it courses from the muscles and that entire area. Fascia surrounds everything and permeates everything in our body. So a restriction in fascia in one area of our body can create pain in another area. And likewise, we tend to feel a lot of things in our back and along our spine, and we think, we have a problem with our back specifically. And sometimes that's not really the case. It just has to do with tension elsewhere. And when we free that up and strengthen other areas where there's imbalances, oftentimes our back pain is relieved. It's just going about it in a specific manner and kind of having it diagnosed either by a physical therapist, some other healthcare practitioner that specializes in movement and specializes in pain, so that you get an idea of what's going on with your body so you know how to correct it. There's a lot of times there's often simple solutions to what might seem like, really bad pain that you've been dealing with, but oftentimes over time you can start to make changes. So with that, I'd like to show you one way to release the hip flexor area, kind of the front of the hip from the thigh all the way up. Sometimes you might even feel it up through the abdominals, up into the diaphragm, because again, everything is connected through soft tissue, through fascia. So pulling and stretching on one area is going to release everything. The key component to the release is spending enough time in there and relaxing the rest of your body so everything can just soften into the release. Okay, so let me show you. I'm going to use a foam roll for this. If you don't have a foam roll, first of all, I recommend that you get one, because you can do a lot of things with it, a lot of release work. There's exercises you can do. It's just a great thing to have for all kinds of recovery and self-body maintenance. But if you don't have one, you can use a rolled up towel, something firm, so a rolled up towel, or maybe even two towels, to kind of get roughly the same height. I think this is maybe about 6 inches high. And what you're gonna do is lie down over it. I'm gonna lie down first, and then I'm gonna bridge up. I'm gonna roll it under, so it's kind of right under the top of my pelvis, where the top of you feel the top of your hip bones right around your sacral area. And I'm gonna let that sink a little bit. I'm gonna stretch my left leg. So I'm gonna bring my right knee up into my chest, pulling it towards me, and I wanna start to feel a little bit of a pelvic tilt as I'm tilting my pubic bone up towards the ceiling, so that I'm not arching here. You don't wanna lift up here. You wanna still protect your back and have a little bit of a tilt, and just kind of sink in. Feeling that pull of the bent knee. And then gradually, depending on your flexibility, straighten out the leg you want to stretch. You should start to feel the stretch all the way. The target area is kind of mid-thigh to belly button level, all through this region. So if you're very flexible, you can pull that knee into your chest a little bit more, tuck your pelvis even more, let gravity work to pull that leg down towards the ground and just soften everything else. Let your body relax. Feel everything let go. Your leg may be higher up in the air. Wherever you are is okay. As long as you feel comfortable, this shouldn't feel painful anywhere. You don't want to feel any pain in your low back. If anything is causing you pain, then either just try shifting positions or stop. Just sink into it. Ideally, you want to hold this for a few minutes, but if it's uncomfortable to start, or your legs you can release a little bit of tension here to bring that down. With any kind of stretching, you just want to feel just the start of the stretch and respect that barrier until it softens, and then pull a little bit more. You don't want to just go right into a point where it's just at the end of your range and where it feels almost painful. You want to start soft and ease into it. So just hang out there for a little bit. You can play with moving this knee out to the side, seeing what that feels like, how it might change the position, change the feel of the angle of the pull through the fascia. And basically, that's it. Just let your body relax into it. When you're ready to come out of it, go ahead and release the tension on the bent leg. Put your hands down. Slowly slide that straight leg up so it's bent, and then put your other leg down. Just, especially if you've been there for a while, because you've been holding that static stretch, things might feel a little stiff, but you still want to open that up. So just take your time coming back out of it, and then repeat on the other side. And that is a great way to release tension through the front of your hips, and taking that tension will, because everything's connected and the muscles through the front of your hip come in and connect to your spine, that will help release tension through your spine as well. So give it a try. See if you are experiencing pain through your back and it feels just more like muscular aches and pains, give that a try, see if it frees things up. I'd love to hear how it works for you. So that's that. Any questions, get in touch with me, and I thank you for watching. Bye.